Hi, my name is Dr. Stephanie Saucier. I'm a cardiologist, and my team actually sent me some videos of people passing out. So they want me to try to figure out if I can tell them why they're passing out. So let's get into it. Oh boy. I'm gonna have to watch that first one again because it's quick. Okay. All right. So that looks like orthostatic hypotension. Essentially what happens is when you're changing position, you stand up and your blood drops because of the gravity. And if you're not actively empowering the muscles to move blood back up to the brain, then you'll feel a little lightheaded or dizzy. In extreme cases, people's blood pressures drop so significantly that they pass out, like in this video. And so some of the things that we tell people in order to prevent orthostatic hypotension, wearing compression socks when you know you're going to be doing a lot of position changing, drinking 8 ounces of cold water before you go to stand up actually will help. It increases the intravascular volume. And then one of the other things that I always tell patients is counter pulsation maneuvers. And so essentially, if you stand up and you're feeling like you're going to pass out, you take one foot, you cross it in front of the other foot, and you squeeze your glutes or squeeze your butt. And what that does is actually gives a bolus of blood back up to the brain. And that has been shown in studies to increase your cardiac output. If you're someone who experiences chronic orthostatic hypotension that is significant enough to make you pass out, then there are some treatments that can be used, including medications to try to keep your blood pressure up, like midodrine or Florinef. Okay, let's take a look at the next video.
Faint with me in class. My teacher and the people sat near me already know about my health issues, so they know not to panic when this happens. I start to get super dizzy here and know it's coming soon. I could feel it coming, so I set up my phone to catch the episode. I used to faint daily, but it's improved with time. Now I only faint every few days or so.
So I'm going to be honest, it's not super clear here in this video, like why she has these syncopal episodes. It's possible that she has a neurally mediated syncope. It's possible that she has a vasovagal syncope from either a pain or something else that's pressing on her vagus nerve. It's possible that she has some type of other autonomic dysfunction, but this video is not clear cut. One thing though about this video that I think is very important for people is she has a prodrome. She knows it's coming. People who have cardiac syncope from dangerous life-threatening arrhythmias do not get a prodrome. So that's actually one of the things we ask most patients is, did you feel it coming on? If you feel it coming on, then it's unlikely to be as dangerous from a life-threatening standpoint, because life-threatening arrhythmias like a ventricular tachycardia or ventricular fibrillation, you do not have a warning. You just pass out. You just find yourself on the ground. They typically wake up with battered face because human nature is if you're going to fall or if you're going to pass out to protect your face. And so if you see someone who has passed out and they have a bunch of face lesions or wounds or bruises on their face, be concerned about the heart. Be concerned about an arrhythmia. All right, let's take a look at the last video. All right, so most likely this is a vasovagal syncope due to increased vagal tone because she's screaming and she's putting pressure on her vagus nerve. This is not something that is necessarily super dangerous to her, but I would avoid doing this again. Now, other possibility, right, because we always want to think of differentials, but another possibility is if she has a stimulated narcolepsy or something where like all of a sudden she were to pass out because of the extreme excitement or fear that she's experiencing during this slingshot adventure. But it looks more like a vasovagal, like a vagal syncope to me. So there you have it. Those are my reactions and what I think about a few people passing out. And remember, if you are someone who passes out chronically or frequently, make sure to see a doctor, right? We do need to get to the bottom of why you're passing out and give you some tips and tricks to make sure that it doesn't happen at times that can be very potentially dangerous to you. But with that, if you guys enjoyed this, please subscribe to my channel. And if you want to learn more, check out my free heart health guide. I'll see you in the next one.